Good afternoon. I am Steve Freel, Mayor for the City of Casper. I come in front of you today to discuss the state of our community. If you've been following the latest events in our community, you know and understand that we are experiencing a troubling increase in positive COVID-19 cases. Just last week alone, we had 178 confirmed new cases of COVID-19, with 86 of those confirmed positives coming in one 24-hour period. Currently, we are getting almost 100 cases a day in Natrona County. We currently have COVID patients in the Wyoming Medical Center's intensive care units, regular care units, and have been forced to use the catastrophic surge overflow unit. This past week, Wyoming Medical Center also declared a code orange. This means they were limited on space for patients, and their staff was taxed with an overwhelming influx of patients. If overflowing patients was not enough, there were 14 members of the medical staff that were out due to contracting COVID or are in quarantine due to the exposures. Losing this number of employees for a regional hospital is a huge blow to the day-to-day, hour-to-hour operations of this medical facility. So how does the overflow of patients to the hospital affect the public as a whole? At one point last week, there were no rooms available in the emergency department, and the waiting room had 17 patients waiting to be seen. These patients were being seen for a variety of medical issues, which were all not COVID-related. The world does not stop because our emergency departments and hospitals are filled with sick people. Car accidents still happen. Heart attacks still happen. Strokes still happen. Medical emergencies other than COVID still happen, and most of these are life and death situations that must be dealt with immediately. Preventing exposures would help this scenario. When we first started into this pandemic, we tried to balance the economy and the health of our community the best that we could for as long as we could. Health officials, in concert with the state, made the decisions to close high-risk services offered by certain businesses and asked people to stay at home, wash their hands, and social distance. While we all made sacrifices to flatten the curve, we saw our positive COVID-19 case count remain low. We watched our neighbors around the Cowboy State struggling with increased positive cases infiltrating their communities. Here in Natrona County, we pretty much knew where the virus was coming from, and it was contained within the groups that we had identified as being the source of the viral spread. After what seemed like months of being shut down, we slowly began to open businesses, getting people back to work in a sense of normalcy. The reopening was not smooth, and we had to work through a few issues. Part of the reopening was asking our community to socially distance and wear face coverings. It took us all a moment to get used to the fact that in some places we would need to wear face coverings, even though we did not want to. After being open for a period of time and struggling to keep customers safe, major chain stores such as Walmart, Home Depot, and Target made the move to require face coverings to be worn within their stores. Overnight, the store's policies changed and customers were turned away if they chose not to follow the store's rules. These decisions were made at a corporate level. However, it was the minimum wage employees at the front door that took the brunt of the anger displayed by a handful of citizens that did not want to follow the request put in place by each business. As stores would require customers to follow safety measures, people began to either ignore the requirements altogether or simply wear the covering past the front door and then remove it once they were inside of the store. A short time later, information began circulating across social media that stores could not enforce these policies and that these businesses did not have the right to take individual freedoms away by requiring facial coverings inside their stores. I'd like to put this way of thinking into perspective. Let me use a few examples from a former colleague who is very knowledgeable and for whom I have the utmost respect. Is it my personal right to drink and drive and put someone else's life at risk? Is it my personal right to physically harm someone because I'm angry or disagree with their beliefs? A person may make the choice to partake in these behaviors, but their rights end when their choices harm others. The fact of the matter is that everyone does have rights, and the intention for asking for face coverings to be worn is not to take rights or freedoms away. It is to help cut down on the spread of a virus. Just as people sitting at home saying that no one can make them wear a facial covering, it is their right not to have to. There's also the opposite side of that statement. The opposite side of that is that businesses do have the right to not allow you into their store to purchase goods if you choose not to follow their requested guidelines. Entering a grocery store is not a right. It is a private business that can allow or not allow whomever they want into their establishment, as well as any other business, be it a restaurant, coffee shop, liquor, or sporting goods store. So the statement of "I have my rights" works in many ways. It is important to evaluate the information we're consuming, especially online. We're dealing with a virus, which means it's crucial to ensure that the information we're reading and choosing to believe is coming from reputable sources, in this case, healthcare experts. I am not a doctor, but I do know that every time I have entered a healthcare facility for a procedure, the doctors and medical staff performing the procedure have been wearing personal protective equipment, including face covering. I can only assume this is because facial covering protects from the transmission of disease, bloodborne pathogens, germs, or virus. Currently, there is a vaccine being worked on for this virus. We have been told that we could see it in early spring of 2021. But in order to have enough of the entire population, it will not happen overnight. Let's be clear. This virus is out in the community now, our community, with asymptomatic people, meaning that they have no signs or symptoms, and they are passing this virus without even knowing it. This virus is infecting people of all ages in our community, with a large majority having no idea where they contracted it. With all the protections put in place, I toured Wyoming Medical Center yesterday and saw firsthand the damage created by this virus. I physically witnessed patients on ventilators, some being elderly, with other medical conditions that are fighting for their lives because this virus has taken a hold of them. While I'm speaking about the elderly, the comment I have heard the most is referencing those elderly patients that have died and that most did not die of COVID. In most cases, this statement is technically correct. There have been elderly patients that had other conditions, as an example, being terminally ill with cancer. The question I have, though, is if this terminally ill patient was given an amount of time to live, but that was extremely shortened due to contracting the COVID virus, how does anyone think that this is okay? As I spoke to a doctor specifically about the elderly patients he was caring for, he shared with me the following. Last Saturday morning at 2 a.m., he was with one of his patients. He sat with her while he held a phone up so her husband of 50-plus years could say goodbye. He said goodbye to her as she passed away. A little after 2:15 a.m. is when she did pass away. It is not right that people cannot be with their loved ones in their dying moments. That is what this virus spread has created. Now, what is our plan, and how do we make things better? First of all, I want everyone to know that the health department in the city of Casper do not want to take a step backward. We have no intention of shutting businesses down or limiting the services they provide. We have no intention of implementing any further restrictions on the community other than what is required by state orders. In order for us to keep those intentions, we ask that you strictly adhere to the guidelines put out by the governor and the state health department. When it comes to wearing facial covering and social distancing, we are not changing anything. that has not already been in place. But I am asking that you please change a few things. The city of Casper does not have an interest in trying to mandate facial coverings. We do not want to go backwards. We only want to move forward. If you decide to go to one of the stores that requires facial coverings, please wear one. You have a choice at these stores to do the right thing. And almost every single one of these stores has established ways that you can do the right thing. If you want to go into the store, then wear a face covering. If you don't want to wear one, then use their app and do your shopping online, where you can pay for it and set up a time to pick it up or have it delivered. Today's technology literally allows you to order a drink online and pay for it, then put a face covering on for 30 seconds to walk in, get your drink, and return outside where you can remove it. These guidelines that I'm asking for you to follow are not just limited to big box stores or businesses. We need to keep in mind that when we are in groups and cannot socially distance, we need to wear facial coverings. When attending events or large gatherings, facial coverings, social distancing, and hand sanitizing should be used. Anytime social distancing cannot be observed and you are closer than 6 feet, whether at work or play, you need to follow these standards. You and your family are important to this community. We want to do everything in our power to keep you, our friends, neighbors, and visitors safe. I want to reiterate that in order to keep our intention to move forward, we need you to please do your part. In order to cut the numbers of people infected by this virus, please stay home when you feel sick, social distance, and wear a face covering when social distancing isn't possible. It's that simple. Let's do the right thing and get these numbers that are taking hold of our community under control. Thank you.
Morgan has a question.
I'll open it up for questions. Yes.
Morgan has a question.
Morgan? Okay. Morgan, you have a question?
Yep. Hi, Mayor. Thanks for having this. So you said that it's not the city's intention to impose any mask mandates. I'm curious, is there a threshold of new cases or rate of testing positivity, what have you, that would force the city's hand in that regard?
As far as right now of having the threshold that would change, we obviously will be keeping in touch with the health department. If this continues to spiral out of control and we can't get a hold on it, then that could be a discussion at a later time. But right now, even where our numbers are right now, there is no intention on behalf of the city to mandate masking. You don't have any other questions? Okay. Thank you.
Okay.